This presentation will review a racial equity-informed breast cancer initiative for African American women and was created by Nia Abdosh, Myra Simone, Alexis Washington, Victoria Barancic, and Katia Salas.
This is a brief overview of what we'll be discussing today, beginning with our introduction and significance of our issue and closing with our conclusion. African American women are experiencing disproportionately higher mortality rates from breast cancer than their white counterparts. While white women have higher incidence rates, African American women experience higher mortality rates and worse treatment outcomes. Additionally, mortality rates for white women have significantly declined over recent years, while rates steadily increase for African American women. Lastly, African American women are underrepresented in research and health studies. We have found that politically media coverage has allowed the public to voice that they will not stand for systemic injustices. Organizations like White Coats for Black Lives seek to dismantle racism in medicine and promote health for all. Economically, one study showed that being African American in itself is an independent predictor of worse breast cancer outcomes, additionally leading to exacerbated financial toxicity. Socially, research found that minority women living in low socioeconomic areas develop aggressive forms of breast cancer, making them less responsive to treatment. Lastly, technology such as the digital breast tomosynthesis has been essential in early detection of breast cancer, which has led to better treatment outcomes.
Our advocacy initiative is to organize awareness campaigns that present the issues surrounding health disparities among African American women with breast cancer. In addition, we will present education programs to healthcare providers, policymakers, and advocates to acknowledge the need for specialized medical screenings for minority groups and to introduce laws and policies against healthcare discrimination. With these initiatives, we hope to educate the public about health disparities and discrimination in the healthcare setting, as well as present strategies to healthcare professionals on how to avoid these health inequities. We also hope to successfully implement laws surrounding specific genetic testing for minority groups and against biased medical treatment.
So why is this advocacy initiative so important? First off, it brings an awareness to the disparities in breast cancer care and how it affects every part of the way Black women experience the healthcare system. Secondly, by recognizing and acknowledging these issues, it will allow for change so that Black women can get the same level of care as their white counterparts.
In order to ensure the success of our initiative, we have a few recommendations that will help. First, we want to call on donors to fund adequate research initiatives and provide financial aid on behalf of African American breast cancer patients. Next, we ask that researchers create a new genetic testing standard to include testing for genetic mutations found consistently in the genes of African American women who have had breast cancer and tested negative for BRCA1 and BRCA2. Finally, we urge communities to get involved in order to help provide more accessible prevention services for its members that are described as having a lower socioeconomic status. Breast cancer is a common illness in the United States. In fact, it is the second leading cause of death in women. Unfortunately, compared to white women, African American women disproportionately die with breast cancer. Our advocacy initiative is to bring awareness to the health inequity faced among Black women in the United States. Our campaign will bring awareness to this topic and educate the public about health disparities faced by Black women. Our hope is that with our initiative, we will help reduce the mortality rates of Black women diagnosed with breast cancer in America.